This presentation, MD Economics, was created to provide information about loan repayment options to current medical school graduates. It was created by the First for Medical Education program at the AAMC. The FIRST program provides financial information, resources, services, and tools to those trying to understand the complexities of medical student debt. The AAMC is the Association of American Medical Colleges. Let's get started. Here's the most recent data on medical school debt. For graduates of the class of 2008, among indebted graduates, the median medical school debt was $150,000. For graduates of private medical schools, the total was a little bit higher. For graduates of public medical schools, the total was a little bit lower. But overall, the median medical school debt of indebted graduates was $150,000. About 90% of all medical school graduates have some level of educational debt. That includes medical school debt and/or debt from their undergraduate days. Before we move on, here are a couple of quick caveats. First, all of the data in this presentation is rounded, usually to the nearest thousandth dollar. It is also based on data coming from AAMC surveys or AAMC analysis of federal regulations. Also want to provide a note of caution that the interpretation of the federal regulation is accurate as of May 2009, but it is subject to change, and as always, these are estimates. If you are a medical school borrower, you should always contact your lender or servicer to discuss your exact loan balances and repayment options. So let's get to the heart of the presentation. Let's take that $150,000 we talked about a few moments ago and apply that to a specific person, a Dr. Median. Dr. Median is going to graduate with $150,000 debt, the median value for the class of 2008. How does she get there? Dr. Median enters medical school in the fall of 2004 in order to graduate in 2008. Here's a couple of data points to describe that time. If you line up the full 4-year cost of all of the medical schools and pick the middle school, that happens to be a public school or Median State. The full 4-year cost of attendance at Median State is $182,000 for the class of 2008. That includes mostly tuition fees and living expenses, with some other costs. Dr. Median graduates with $150,000 in debt through the Federal Stafford Loan Program. That $150,000 includes $34,000 that is subsidized and the remainder unsubsidized. For the purposes of this presentation, we're using the current Stafford loan interest rate, which is 6.8%. The interest starts accruing with the first disbursement in the first year of medical school. All told, during the 4 years of medical school, Dr. Median accrues $17,000 worth of interest on her Stafford loans. Immediately after graduation, Dr. Median enters a 6-month grace period where no payments on your loans are made, but interest continues to accrue. At this point, another $4,000 is added. So, after graduation and the 6-month grace period, there's a capitalization, and Dr. Median's balance is now $171,000. At 6.8% interest, the monthly payment for the interest alone is about $1,000.